So that's the first part about the overlap of ADD with learning disorders. What I'd like to do now is move into comorbidities related to emotion. And I'm going to be talking in more detail about this for tomorrow. If any of you are coming back, you'll have a chance to hear much more detail about the role of emotion in ADHD. But for right now, I'd just like to talk about comorbidities. First of all, keep in mind that all information processing is emotional. Ken Dodge wrote about this back in '91. He said, you know, emotion is the energy level that drives and organizes and amplifies and attenuates cognitive activity. Or, to put it in terms of Damasio and Ledoux, a couple of neuroscientists, they say, you know, the emotional value of something, how important it is to us, is unconsciously assigned to stimuli automatically through the amygdala and the medial prefrontal cortex. So that the question of how threatening is what I'm just seeing, how important is it, how interesting is it? These are all things that are operating automatically as an aspect of executive function. And we've got a lot of studies now that show that reciprocal connections between the parts of the brain that regulate emotion and the parts of the brain that regulate these executive functions. But it's also true that this is what I'll be talking about mainly tomorrow, is that executive functions also allow us to impose top-down control on emotion so the emotion doesn't take over too much of one's life. It doesn't gobble up all of the space in one's head as a computer virus gobbles up the space in a hard drive. Now, when you begin to look at this, what you find is that there are dimensional impairments in emotional regulation. And what I'm arguing, contrary to the DSM-4, is that some impairment in ability to regulate emotions is a core characteristic of ADHD. This is what I've written about. Russ Barkley, I mentioned this morning his article that just came out a couple of months ago. And that impairment in ability to regulate emotion occurs on a continuum. Some people have a little bit of trouble with it. Some of them are big-time hotheads, or very quick to get very anxious, or overwhelmed by their anxiety, or overwhelmed by their worry. And persons with ADHD, so we've got this continuum of impairment in emotional regulation. Persons with ADHD and severe impairment in the regulation of particular emotions may need another diagnosis. ADD plus mood disorder. For example, if a person gets depressed a whole lot and they can't keep the lid on that depressive affect, we might say, well, this is ADD plus on top of that they've got a depression. Or somebody who gets very, very anxious and it's like they can't put the lid on it, they're constantly worrying, this stuff is bubbling up all the time. We may say, okay, they've got ADD and on top of that they've got generalized anxiety disorder. Same thing with OCD, same thing with bipolar. So what I'm introducing now is this notion that in some cases the executive function and regulation of emotion may be just a part of the ADHD, that there are problems regulating their emotion. That's just sort of what happens with people with ADHD. But then that there's a point where we'd say, well, it's now getting to the point where we'd say, no, that's not just the trouble that most folks with ADHD have in regulating emotion. That's enough. We need to say that's a mood disorder. Eric Mick at Harvard did an interesting study. Well, first let me use the top quote by Banaszewski. This is from our European colleagues. They say, many deficits of ADHD are shared with other disorders. That's that cross-cutting thing I was talking about before. And some differences between ADHD and other disorders may be quantitative rather than qualitative. Look at that last phrase. That's what's important. They may be quantitative rather than qualitative. And the thing that Eric did in this study was that he was looking at data on the case ads with kids and the way in which issues of irritability were registered. And what they found was that they could look at the reports of these kids and differentiate on irritability. Now, some folks say, oh, you can't use irritability to differentiate ADHD and bipolar because you see irritability in both of them. And Eric said, I think you can see the difference. Because there are levels of irritability. There are some kids with ADHD, they're playing a video game, and it's time for them to go to bed, and you say, in about 5 minutes, you're going to have to shut that thing down and get your PJs on and get ready for bed. And the kid says, no, I got to go on with this. I'm in an interesting part in the game. And you say, well, I'll be back in 5 minutes. And then you come back in 5 minutes, and they gripe a little bit, and they stomp a little bit, but they'll go upstairs. There's some other kids, and often young kids who are depressed get irritable more than they get bummed, where you say to them, you got to stop the game. And the kid, swears a little bit and tosses something down and then goes upstairs and slams the door. That's a little bit more heavy-duty irritability, but it's not that bad. And then you've got the kid with bipolar disorder, who you say you've got to stop, and the kid says, "I'm not. Don't bother me." Still going at it. And you say, "I'm going to have to take that away from you if you can't stop. I'll give you a couple more minutes," and then you come back a couple more minutes, they're still at it. You get a slew of obscenities, and the kid starts knocking stuff off the table, kicks the TV, knocks the TV off the stand, slams the door, and is willing to break the game that belongs to him and hit people. That's bipolar aggression. And so what Eric is doing is saying these little marks are that for ADHD, you've got a certain amount of it. ADHD plus depression in a kid, and you've got a little more irritability. And then you get to the point where you say, no, that level is not enough to say that's just part of ADHD. That's big time irritability. That's bipolar. That's explosive irritability. And this model can be applied to understand any one of a wide variety of other disorders. But there's a certain amount of it that may go with ADHD, but then you get to a certain point and you say, that warrants another diagnosis. And Geller has written about this, Elizabeth Geller, trying to make a distinction between the ADHD comorbidity and what do you see with some of these others in terms of psychosis and so forth. I don't want to take the time to go through all this, but the point is that there's some other problems that go along with that high level of irritability that constitute what we would call bipolar. This is just a short version of it. In the case of the bipolar, you see in that line irritability and rage. You get some of that with ADHD, but with bipolar, that's a 3-star job. Hyper, a little more, but you get quite a bit with some combined type ADHD. Inattention, that's true in bipolar too. Depression, plus or minus, but you pretty much see it in bipolar. Substance abuse, way more in bipolar. And psychotic thinking, yes, more often in bipolar, not in ADHD. So we're looking at syndromes where there is overlap, but there's a point where the overlap needs to be considered a separate problem. Let's talk for a few minutes about social ineptness. Now, a lot of people with ADHD have significant chronic problems in getting along with other people. They're either too hurried or too intense, too in your face, or too clueless and too out of it. And these can cause a lot of problems. This has to do with emotional intelligence and ability to sort of size up where other people are coming from. My colleague at Yale, Peter Salovey, has written about this with his colleagues and has defined social intelligence as involving 3 components. One is the ability to monitor what I'm feeling myself and what the emotions are in the people around me. Secondly, to discriminate among feelings so that I can tell the difference between when I or somebody else is annoyed or disappointed or hurt or worried or bored or whatever. And then the third one, which is particularly important, is being able to use that information to guide what I'm thinking and what I'm going to do. Now, that's all, many of you probably read Goldman's book on emotional intelligence, and the subtitle of that, Why Emotional IQ is More Important Than IQ in Life. He's sort of overstating his case in some ways, but he's got an important point to make. Now, the thing is that emotional IQ is not the same as IQ measured by the IQ tests. There are some folks who are very, very bright who have very low emotional intelligence. Haven't you had some of these people as teachers or professors or coworkers where they're really, really smart and they have excellent grasp of their subject matter, but you would not want to invite them home for dinner? And then there are other people who may have excellent ability for dealing with other people, but they're just not that smart. The point is, these are 2 different things. Good knowledge and high IQ alone are not enough to make somebody really good socially. And that makes sense because there are different neural circuits involved in these various things. You see them named here. And we've got data now which tells us that ADHD kids as a group, now that's not true for all of them. Some of them are wonderful in terms of their ability to get along with other kids. But as a group, ADHD kids are not so hot at being able to read the emotions of others. They're not quite as adept as kids their age who don't have ADHD in identifying their own emotions and those of others, and that they certainly seem to have a lot more trouble in being able to know what to do to deal with social situations. But we've got a wide variation among all kids, ADHD or not, in all adolescents and adults in terms of this emotional intelligence thing. And what I'm suggesting is that many, but not all people with ADHD are impaired in this emotional intelligence. And so it goes from like small, medium, and large, and the more extreme end would be the kind of thing that we speak about as Asperger's disorder. And the basic characteristics of Asperger's are when you meet somebody with Asperger's, often you just have the feeling they're a little weird. You know, and then you have to ask yourself, well, what is it that makes them seem weird to me? Well, part of the time is often they won't look at you. You know, that they'll just be, they're carrying a conversation with you here, and they're looking over here at the wall steadily, or down at the floor. They often have unusual interests. One of my colleagues had a patient with ADHD, a young kid who was interested in deep fat fryers. And if he and his family went into a restaurant, the kid would flip out totally if he was not allowed to go into the kitchen and inspect their deep fat fryer to see what kind they were using. I had a 10-year-old one time who was interested in medieval musical instruments. And this kid knew more about medieval and musical instruments than most anybody else I've ever met. But the problem is they have these very narrow interests, and that's all they can think about or talk about. You know, it may be varieties of dinosaurs, something that many kids are interested in, but most other kids can also talk about other stuff besides dinosaurs. Kids with ADHD, often you see a narrowing of interest or an intensification of it so that that's all they're going to talk about. They often have difficulty in making a two-way relationship with somebody else. That there's not that reciprocity, okay, you talk, I talk, you talk, I talk. Their nonverbal communication is difficult, and often their language patterns are a little bit off. For example, I remember one kid with Asperger's I saw with his mother one time, and she was trying to convince him that it was going to be interesting to go to this program that she'd planned to take him to, and she said, "This is really going to knock your socks off." And the kid's jaw dropped and his eyes opened, and he looked at her and he said, "How can that happen?" The main thing is the second point in this series, on the second bullet there, that they lack the ability to empathize and interact with peers. Notice the with peers. Many Asperger's kids are really pretty good at dealing with little kids because they're the boss, or with adults because they're more predictable. But they have the most difficulty dealing with other kids their own age because that's a more difficult context in which to operate. They're less predictable. This is very similar to what Martha Dankler has spoken about in terms of nonverbal LD, the inability to grasp the big picture. You know, they're going to tell you about some movie they saw, and it's like they can't summarize it. It's going to take as long for you to hear from them what was going on in the movie as it would to go see the movie. And it has to do with the way their head organizes, but this is primarily a right hemisphere thing. Ornstein wrote about this some years ago. He said, the right hemisphere decodes external information that we use to compute context. It helps us assemble the whole field of view, social intelligence, like being able to judge the tone of voice, being able to understand facial expressions, to decode emotion, to tell when somebody's joking or teasing with us and when they're lying, and to grasp the true meaning of indirect statements. All of those things involve the right hemisphere. Now, it's not like anybody does anything that's just right hemisphere or just left hemisphere, but it's that the brain functions, there's a specialization of labor, and it turns out that a lot of these difficulties that have to do with social functioning that are so impaired in people with Asperger's typically are right hemisphere functions. And we've got quite a bit of data to say that right hemisphere is a little more problematic for many people with ADHD. Not always, but pretty much. So what I'm proposing is that there's a lot of variation among all children, adolescents, and adults with emotional intelligence. And not everybody with ADHD has Asperger's, but there are a lot more people that have been recognized with it. So here I'm offering you 3 different examples. We could talk about a bunch of other stuff with different disorders. But the fact is that, at least as I see it, we've got factual data which say kids and adults with ADHD often have one or some combination of other comorbid disorders with it. I'm suggesting that a lot of that has to do with the fact these executive function impairments underlie a whole bunch of other things that are components of other disorders. I'm suggesting that differences between ADHD and other disorders are often quantitative rather than qualitative. That it's a little more of something rather than something that's totally different. And that learning disorders, especially reading and written expression, bipolar and Asperger's are 3 examples of quantitative differences that we see among people with ADHD that may be particularly problematic, where there's something additional there. Asperger's is not equivalent to ADHD. Learning disorders involve some specific impairments that are not included in ADHD. Mood disorders, some problem with mood, we say, well, yeah, that's part of ADD. Push it to a little bit higher, and we'd say, no, that's something different. But this is just a little different way of looking at the relationship with ADHD and other disorders, which I am submitting here for your consideration.